Diuretics. We're going to cover three main types of diuretic: loop diuretic, thiazide diuretic, and potassium sparing diuretic. The all diuretic works on kidney, and especially nephron, which is a functional unit of kidney. We're going to talk in detail about each diuretic's mechanism of action, what are their side effects, in which disease condition we use, and the nursing consideration. Okay, so let's talk about first loop diuretic mechanism of action. Okay, so this is the diagram representing nephron, and which is the functional unit of kidney, and all the blood filtration, formation of urine, reabsorption, and excretion of all the electrolytes happen in this nephron. However, we are interested in the reabsorption and excretion of sodium, potassium, and water. Now, before we go into the mechanism of action of loop diuretic, let's understand some part of the nephron and where the sodium, water, and potassium reabsorption excretion occurs. So first of all, proximal convoluted tubules, where about 65 to 70% of sodium gets reabsorbed. There is no diuretic that works here. So 65 to 70% of sodium is going to get reabsorbed no matter what diuretic we give. However, this is called descending loop of Henle. This is loop of Henle, and this is ascending loop of Henle. Now we are interested in ascending loop of Henle. In ascending loop of Henle, there is a pump. It's called Na plus, K plus, 2Cl minus. Now this pump, what it does, it uses the energy. To reabsorb sodium, potassium, and chloride back to the blood. Now, when sodium gets reabsorbed, water is going to follow sodium. So water is going to get reabsorbed as well in ascending loop of Henle. Now here, about 25% approximately, sodium gets reabsorbed using this pump, which uses the energy as well. Now loop diuretic inhibits the whole pump. Loop diuretic inhibits this whole reabsorption process. When the sodium doesn't get reabsorbed, potassium doesn't get reabsorbed, and chloride doesn't get reabsorbed, water is not going to get reabsorbed as well. And when water doesn't get reabsorbed, if you look at it here, right, the ascending loop of Henle, it's going to go from here to the collecting ducts, and from there it's going to get excrete through urine. So sodium, water, and potassium and chloride, they're all going to get excreted through the collecting ducts without gets reabsorbed, since loop diuretic is going to inhibit the pump. Since we understood that mechanism of action of the loop diuretic, let's just talk briefly what it does on the nephron, and especially more in detail like ascending loop of Henle. And if we know this three main mechanism of action of this loop diuretic, we'll be able to understand the side effects and also the nursing consideration as well. So it prevents the reabsorption of sodium, water, potassium, and chloride. Okay. Now indication, because of this, it excretes the water. It can be used for the prevention of edema. We can use this medication to prevent the edema that happens in the heart failure, pulmonary edema, hepatic failure, or hepatic cirrhosis, or chronic renal failure. This medication is also used to treat hypertension, especially furosemide, or also we call this one as a Lasix or water pill. This particular drug physician uses quite often to treat hypertension as well. The next slide, we're going to talk about the side effects, nursing consideration, and contraindication. Now, as we talked, the mechanism for action, it affects many electrolyte reabsorption in kidney. So the first side effects is electrolyte imbalance, which the first one is causes hyponatremia. Now, when we cover lithium medication, which is bipolar medication, we'll go over why the hyponatremia can cause the lithium toxicity. But since this medication can cause the hyponatremia, and if a patient on lithium medication for bipolar, that can cause serious lithium toxicity. It can cause, since the hyponatremia, because of the hyponatremia, it can cause the central nervous system changes, such as headaches, changes in level of consciousness. So we have to look for those symptoms as well. Another electrolyte imbalance is a hypokalemia. Now, due to the low potassium level, now the normal potassium level is 3.5 to 5.2. Okay, so usually if a hypokalemia is lower than 3.5, now it can cause the cardiac arrhythmia and also the digoxin toxicity. Also, we will talk about digoxin in cardiac glycoside slides. Now, digoxin toxicity can happen when there is a low potassium level in the body. So you have to look for the digoxin toxicity as well. And this finally can cause the hypocholesteremia, which is low chloride level. So if you go back to the mechanism of action slide, and if you look over it, remember we talked about that it prevents the reabsorption of sodium, potassium, and chloride. So it's kind of self-explanatory that why this medication can cause the hyponatremia, hypokalemia, and hypocholesteremia. Now, also as a nurse, if a patient on this medication, you want to monitor the electrolytes, sodium, potassium, chloride, magnesium, and calcium, okay? This medication also can cause significant hypotension, and that's why you have to teach the patient about their side effects like fainting and dizziness. And since this drug also excretes significant amount of water and causes diuresis, we have to teach patient to look for the signs and symptoms like thirst, dry mouth, significant weight loss, low urine outputs, usually less than 30 ml per hour. This medication also can cause the ototoxicity, and one of the signs of the ototoxicity is tinnitus. So you have to look for, which is basically ringing in the ears. Okay. So what we have to teach patient and what the nursing consideration. So first of all, have to tell patient to eat high potassium foods because it causes the hypokalemia, such as bananas, potatoes, or whatever, like the high potassium containing foods. I have to tell them monitor for signs and symptoms of hypokalemia, such as nausea, vomiting, and generalized weakness as well. We have to tell them monitor their blood pressure daily. Okay, and avoid using other ototoxic medications such as gentamicin. And since this medication can cause sudden change in blood pressure and can cause the hypotension, we have to educate patient that to avoid sudden changes in the position, rising slowly from lying position to sitting and so forth. They can't just change their position suddenly because it can cause significant decrease in blood pressure and can cause the dizziness. So what are the examples of loop diuretic? The first one is furosemide, which is widely used, torsemide, bumetanide, and ethacrynic acid. I haven't seen this medication used quite often in patient. I've seen the furosemide and bumetanide because bumetanide is a really strong loop diuretic compared to furosemide. So if they really need a huge amount of diuresis, they prefer to use bumetanide compared to furosemide. So that's the nice thing to remember if you're working on the floor and kind of wondering like why they're using bumetanide instead of furosemide. It's because of they need a high amount of diuresis.